The Heart of Nursing project seeks to provide some understanding of what is at the heart of nursing practice today. Through interviews with nurses working in the Tasmanian health system, this film investigates the diverse ways in which nurses view their role and explores the notion of the heart of nursing through storytelling.
The first thing that came to mind was, I think I work with a lot of older people, and particularly a lot of patients with dementia and that sort of thing. And I think for me, it's creating, I guess, a lasting moment for them that they can be happy being a part of, making their sort of time in hospital a little bit easier. And I remember back to one evening where I was so frustrated and like kind of busy and I'm running around trying to do all these things, and someone else was in this patient's room and I was like, can you just come and do this for me really quickly? And anyway, this old lady is sitting in bed and he's trying to tuck her in, and she just kind of looked up at me and was like, oh, sister. And I was like, oh, I don't have time to be nice to you right now. And then I just thought, okay, no, this is what it is about, is making time for people. It only takes a minute. And I went over there and she's like, I have to ask you something. I was like, okay, what do you need to ask? She's like, I can't ask the man because, you know, it's not right. She's like, I need a hug goodnight. And I was just like, oh, my heart just kind of like melted, because 2 seconds before I was in this like kind of, oh, this is so annoying, you know, I've got all these things to do and you're asking me to come over and someone's already in here. And then she proceeded to tell me the story about her husband had just died recently, and every night she said, I'd never spent a night by myself before he died. She's like, all couples are so, you know, nasty to each other these days, and we were always so lovely. And while she's telling me this, she's like hugging me dearly, like right in my ear, and telling me this amazing story about her life and what it meant to her to have someone say goodnight to her. And I just thought, yeah, that's actually, those moments are the ones that you remember, and that you get so focused on all these things that you have to do, these tasks, and oh, I need to do this and I need to do that, and sometimes can forget that these are all just people. They have their own little stories and little things going on, and something like that made so much difference to her that evening. And it didn't really take anything at all. Like, it didn't require any kind of, I guess at uni you learn all these things that you have to do, but really it's just being a person and being compassionate for other people's things that they have going on, I think. I guess that for me is what the heart of nursing is about.
For me, really, nursing is about people, primarily, and that's something I've learned over my time in nursing. And when I say about people, I mean, you know, about the whole person, and not just looking at a person with a disease or a person with an illness, but actually looking beyond that and looking into the person and finding out more about that person. I guess that started for me back probably 18 years ago when I finished my nurse training. I was working in a busy ward in Glasgow at the time, and we had a patient who was on that ward who'd had a stroke, and so he needed a lot of assistance to mobilise. He wasn't able to talk, so he wasn't able really to verbally express what he needed. So one day anyway, I was in there, we had the curtains pulled around, and it was an old Florence Nightingale ward, so much like this, you know, all the patients along beside each other. So anyway, I went in one day and we were going to move him back from his chair back into his bed. So I said, oh yeah, I'll just call him Joe. I said, all right, Joe, I'll come in, I'll give you a hand, we'll get you back into bed. So anyway, I did the whole thing, and in my mind, all I was thinking was, right, you're going to mobilise someone, so you have to stand a certain way, you have to hold a certain way, and, you know, right, move forward, Joe, yep, stand up, and we're waltzing around the room trying to get him back to bed. And all I had in my head was doing it the proper way, doing the proper procedure, making sure I did it properly, etc., etc. Anyway, I could feel this warm stream down my leg, and I thought, oh, that's a bit weird. Anyway, so I looked down, and sure enough, Joe had just let loose and peed all over my leg. And I looked at him, and I was sort of dumbfounded at the time, and then I looked at him, and he was laughing his head off. And I thought, yeah, that's it, exactly. You know, I was too focused on just thinking about the procedure and had completely forgotten the person and the whole thing. And as soon as he did that, I realised, you know, he was telling me, you know, there's a person here, and I've got a sense of humour, I've got a personality, I've got this, and it brought me right back to where I should be. And when I reflect on that moment, and that's what I always think about. I think, right, you've got to remember in this whole process there's a person there, and really that's what it's all about. So yeah, so I thank Joe for that experience, because it really changed how I practiced and changed how I approach things. And you know, it's not all about the procedure and you know, taking a blood sugar level or giving someone dialysis treatment or whatever it may be. It's more than that, and that's just a tiny, tiny part of it. Yeah, and I guess as I've gone through my career, I've really used that experience to guide my own practice. So I've always tried in various instances to make sure that, you know, I listen to the patient, I understand what they're telling me, you know, I listen to their life story, because, you know, that person, we're only seeing them for a fraction of their lifetime, but really they've got a breadth and a wealth of experience that, you know, we can listen to and we can learn from. And it's not just about that one moment when they're in hospital having a treatment or whatever it might be. We had another example last week in hospital with a patient. Again, she had a really bad infection, and she'd actually was getting confused and had lost her voice. And she was sort of sitting in the room, and I walked past and said, oh, how you going? Are you all right? Because as a dialysis patient, you know, the nurses and dialysis patients know each other so well. And she just sort of looked at me and started crying, and I thought, oh, okay, something's not right. So I just went in the room, and she was in isolation, so I had to put all the gear on and whatever else. And I just went in the room and I just sat there and just listened to her. And eventually she got the words out she wanted to get out, and you know, she was really just scared. She was confused, and she was scared about why she was confused. And so I just sat there and probably for 15, 20 minutes, and we just listened to what she had to say. And the next week actually I came back, and she was still in hospital, but she was on the mend. And she just said, thank you. And I said, thanks for what? She said, you just listened to me. And that was all I needed. And so that experience, you know, just reiterated the importance of listening and understanding people, because it's not always about what you do. It's not always about the things you do, it's about what you do. And I think that's an important aspect of it's humanity, really. It's treating people like you would expect to be treated, treating people like family. And that's in my experience what it should be. That's what nursing is. That's the heart of nursing practice.
So I think back to when I was a brand spanking new nurse, so straight out of uni and in my first job. And I was working on a very glamorous unit, colorectal and gastroenterology, and looking after a girl probably not dissimilar to me in age who had Crohn's disease. And I think as a student, you're taught all these technical skills, and I could do a blood pressure and I could write those on the chart and I could measure what went in, what came out, and I knew what Crohn's disease was. And I guess as a student transitioning into becoming a nurse, you focus very much on wanting to get the bits of the job right. Because of the chronic nature of the illness, she was in hospital for quite some time, so I got to know her over her period of her admission. And I guess what I started seeing was she had the boyfriend would come in and visit, and then slowly the visiting would start to drop off, and then the stories would come out about how the boyfriend was really struggling to cope with her illness, and eventually that relationship ended up breaking up. And that's, I guess, for me, when I started to almost realise that patients, in a sense, are normal people just like me, and they have lives outside of what I'm seeing in a snapshot of there being a patient in hospital. I started to see her as more than just being the patient that I had to give this technical care to. And I guess for me, from that experience, learning that patients are people too and have lives just the same as I do. They have to get up, deal with family, work, social interaction. And it really sort of opened my eyes to that. What really at the heart of nursing for me then became was seeing the patient as much more than a set of technical skills I needed to complete to get them safely through that period of care. It was really treating them as a person. For me, going into an education type role, I think it certainly changed the way that I would interact when I had students working with me under my supervision, because I obviously came out of university very capable with clinical skills, but not so much maybe with the interpersonal skills. I think I thought I was very good at it, but it was learning how to actually do that in practice. So that then became more of a focus with me with students when I worked with them about how we would teach them to see patients as people. I don't think we give enough credit to what patients are actually teaching us, because I think we're so focused on what we do for them or what we're teaching them about health, but not really getting that we're learning from them just as equally as they learn from us. She gave me a card, and I still have that card till today, and in it just said, "Thank you so much for listening." And I still have it today, so yeah.
I think for me it's about the sense of community amongst nurses. I think nurses as a group of people that obviously have a duty of care to the people that they care for are quite like-minded, and they share in common experiences when they're actually caring for people. And I think it's difficult in some ways for other people to understand exactly what that might actually be, because obviously it's a very intimate experience, but for me it's actually being immersed with a group of people that are all working together to actually care for patients. So nurses working together in an environment and all trying to do the same thing for someone, for me I see that being part of that is very important, and for me that's the heart of nursing, is actually being part of that greater good, I suppose. I think when I think back to as a graduate nurse, I can pretty much recall about 80% of every moment of that year, because it was obviously a huge learning experience, and it was just looking at how the nurses around me interacted with each other, with staff, with patients, and just sort of thinking, I would never say that, or that's a great way of saying that, or doing that, or whatever it might be. So you build up this repertoire, or you set these precedents in how you want to actually practice and be part of that community, and how you're going to contribute to that group of people that want to do that. So I think there's all these little tiny snippets of conversations or interactions, which really for me was centred more on how the staff were doing what they were doing with the patients rather than what the patients were doing, I suppose. And I suppose that was me trying to find my feet of where I fitted in that big machine. The patient's obviously still there, but things like there is a situation where a patient needs to be better advocated for, and watching a group of nursing staff trying to package together information to advocate for that patient, and at the time I was in a position where I couldn't really do that because of my level of expertise. But just watching how they manoeuvred through the various levels of the communication tree to try and get something done, which at the starting point looked like it was going to be impossible, but they just seamlessly seemed to be able to fulfill that objective, and obviously that benefited the patient. But I just used to think that dedication right there, that's quite amazing, that they didn't sort of look at the hurdles, they just did what they needed to do. And obviously that comes with its challenges and all the rest of it, but I just could remember thinking, I can't wait to be able to do that and feel comfortable doing that. And so I suppose that set the scene for me at that early in my career of what the heart of nursing is just that dedication to the patient and just being comfortable to be able to maintain that.
Well, I think what lies in the heart of midwifery for me is the wonderful, joyous experience of delivering a new life into the world. And I'm actually in love with little babies, neonates. I fall in love with everyone I see. And I think it's a privileged position to be in, that you can be there with someone who's delivering a baby and experiencing birth, and with a partner and the father and the family. And it's a joyous experience, and on the whole, and especially last night it was for two, and you can be there sharing that, and it's a privilege, and making it as easy as possible for them. Because childbirth is hard for women mostly, and you are there as a privilege to make it so it's the most comfortable and nicest experience possible for them. And it's always the case once the babies come, the whole world is different from when they're in labour. So yeah, I think that's my biggest privilege with midwifery, but it's also gaining, I have a big focus in my nursing practice to make it a woman-centred nursing practice, so that they've often read about, especially the first-time mothers, that they've read about what they want in their delivery and in their birth and labour, and often things don't go to plan, so it's about channeling your energy to make them accept things for what you don't have a say in, but giving them as much of a delivery that they've got ownership of. And I think that means that they feel empowered with that process. They often relax more, and the labour goes much more smoothly. And you can't change things that go wrong, because that's the nature of childbirth. It's quite a precarious thing in many ways. 200 years ago, the stats weren't too good. Modern medicine's changed that. But it's also perceptions that, sometimes you have a vision inside your head that my birth, especially first time, is going to be wonderful. I'm just going to have a normal delivery. It's all going to be fine, and then things go wrong, and you have to support them and channel them to accept the things that they can't change.
I gave it some thought when I was asked or invited along, and really I thought back to a story that happened to me when I was quite young in my nursing, and it was around a patient that I looked after who was a palliative care patient, and that in itself was a traumatic thing, dealing with someone who was at the end stage of their life. And palliative care back then was a lot different than it is now. It was a longer process, and there wasn't as good treatment regimens available. And I nursed this lady as a primary care nurse for about 3 weeks before her eventual passing away. And throughout those 3 weeks, her husband was with her, and she was an older lady, and she had a sister that had been her primary carer at home for the couple of months leading up to her deterioration to her demise. And if I set the room, it'll probably give you some indication of the dynamic, the family dynamic. The lady was in the bed, which was central to the room, and the sister was sitting pretty much beside the bed at all times through that 3 weeks, and her husband, who I'll call Des, was sitting over against the window, and often would be looking out the window, but always mindful on what was happening to his wife. And we administered care for a long time, 3 weeks for that lady, and on her eventual death, I was caring for her on the day she died. And I was very mindful that we provided good, efficient care for her, because she was in a fair bit of pain. She had a metastatic disease, and the cancer had eaten away at her, as in her terms, because she'd become quite emaciated. And we were providing good care, feeding her and cleaning her, and fundamental stuff really at the end, managing her pain as best we could. why I reflected on this lady was really about the care that I should have been administering to the rest of the people in the crew. And really that is what I think is about the heart of nursing, because on her death, we did, and it was a private hospital, and it was a very nice little hospital, and after her passing we laid her out, and her husband spent some time by himself with this lady. And on leaving, I went up to him and I said, "Oh, Des, are you okay?" And he said, "Oh, thanks very much for all you've done for me, Laurie." And he shook my hand. Well, the handshake went on for 20 minutes. And as a young man within that space, it was quite confronting for me to be holding some other man's hand that was peripheral to my life, really, for 20 minutes. But at the same time, I was actively reflecting on what I'd done, or really what I hadn't done for Des. And one of the things that Des and his wife taught me was about how to include a family in that care, and how significant others are to the care of people. And really it was quite upsetting after I left, and I reflected, we had a close team of people, and I said to my mate, who's still a very good mate, and we reflect on that situation quite a bit, I said to him, "Oh, I let him down," and he said, "Well, maybe you can think about that into the future, but what do you do for him now?" And I said, "Well, I don't know if just shaking his hand for 20 minutes is enough for him." Anyway, he said to me, "Well, sometimes you'll never know about that, but you didn't break away and you let him release." So he was comfortable to let go. But it stuck in my mind for some time, and it still sticks in my mind now, some 15, 20 years later, about how important it is to focus on not only the needs of that person and providing them good care, but how entwined our lives are from a significant other perspective, and the loss that we might suffer, and how we can reflect on our own losses in relation to how we want to be treated and how we want others to be treated around us, and how we want to treat people into the future. So I think that's probably the essence of the heart of practice for me. It's that inclusiveness of care and recognising that person as an individual in the own web of their life, rather than our close interactions and what we do to people and for people, just as individuals.
I've been nursing now for nearly 6 years and currently work in a community setting out in rural Tasmania. I grew up in the small town that I work in. The area has a population of around 3,000 people, but the towns are scattered up the coast and are sort of 300 or 400 people per town. So everyone really knows everyone. And going into an area where you grew up, you of course nurse people that you knew as a child. And I think that something that's really important in nursing is listening to people's stories and being someone who's curious about people's backgrounds and the worlds that they themselves have grown up in. Something that I find really interesting and that I've been keeping a diary of since I started nursing was the sayings that people have. And one of the best sayings I've heard recently is a lady came in, it was a big easterly storm coming through, and she comes in and she goes, "Oh, wet bum, no fish, big easterly rolling in." And just these sayings that people really don't gather and don't keep and collect, that are just so typical of country life and the people that live within it. I work within a team of 4 other nurses. We all work part-time, and there's often days where there's only one of us on for the round of the area. So you have to be very autonomous. You have to not leave things at the end of days for someone else. So it's quite a different environment to an acute setting where you have this rolling shift of if something gets to the end of the day, you can hand it over. In a rural setting, you have to think on your feet. You have to be creative. You have to be able to make a silk purse from a sow's ear in a lot of cases when you're out and about. So it's certainly taught me to approach things in a very pragmatic way when it comes to my nursing care.
I'm a critical care nurse by my profession. That's really where I strongly identify. And so a lot of my stories there would be quite sad. And I don't really want to choose a sad story necessarily. So I draw on my experiences of where I was working outside of critical care. And so I did some specialist training in neuroscience, and that was in England, and it's probably the hardest I've ever worked in my life. It was really, really hard work. But I actually engaged with people that were perhaps given really bad news, and I felt really privileged to be with them in a space where they were coming to some sort of decision about their life journey, whatever that may be, whether that be a positive outcome or maybe a negative outcome. And so again, even where it's a sad story for them, for me, I felt so deeply connected with another human being by being present with them during a really difficult moment in their life. And so that connection for me felt to me what is the essence of nursing, where it really, maybe I didn't make a lot of change in that person's life, but they were able to cry with me, they were able to share their story, and so it's just me having that physical presence with them and that real connection with them that really was probably the most meaningful. And I've had multiple episodes like that, but that really stands out for me, and particularly that episode where it was a male, and he was in his 40s, 50s, and so at the time a lot older than me. But I felt really privileged to be able to be there for that person at that time, in a very difficult time in their life. It was just this connection that I felt we had, and I mean, it was on night shift, so it wasn't a person that I had any connection with during the day. So it was in the middle of the night. He'd woken up. Obviously, he'd been thinking about the diagnosis he'd been provided, and I just was, doing my round, and I saw he was, restless, and then we just connected, and he just told me what he'd been told that day, and he cried on my shoulder and that, and so it was an unexpected moment, and I just felt so privileged to be there with him at that time, even though it was a really difficult moment. And me being female and being English, I'm not really a touchy-feely person, but for him to actually want to be in my arms to cry, and we just had this, fairly long, deep moment, and then we moved on, both of us. He went to sleep and I went back to my ward round sort of thing. But yeah, so I think that was a really sort of moment for me. I don't know how you describe that, but it really is connected and remained with me for many, many years since. That was a long time, so it was probably I'd say probably 20 years ago. And I've still remembered that. And I've had multiple moments. I've had really happy moments where, again, actually in the same hospital that was in England, where a lady, and it sounds awful, but she looked like a Cabbage Patch doll. She had a beautiful round face, and just every time she saw me, she lit up. She was a lady that had some cognitive impairment because it was a neuroscience ward, so she'd had some sort of brain surgery. But she thought I was her granddaughter. And for the whole of her time there, she thought I was her granddaughter. And so we had this real, every time I entered the room, she would, "Hello, darling." And it was just this, and I role played a little bit for her, so there's moments like that I've sort of remained deeply entrenched in my being, I suppose, as well. I guess coming to more recent times in critical care, where I was caring for a patient who, it was Christmas Day, and he was had been declared brain dead. He was a young boy and had a very significant head injury through a risk-taking behaviour, and he was going to donate his organs that day, and so we were waiting for the retrieval team to come across from Melbourne, and everybody was in the corner or out in the main part of the ward celebrating Christmas. There were family members there, Christmas tree was up, the lights were on, and I was away from the main group of the ward in a sort of more isolated space, but still in the main area, caring for this patient. I couldn't join in with the celebrations, as it was a very tragic time for that patient's family. And so I connecting with the patient, even though, legally they were brain dead, so they were legally dead, but I was still having to connect with the family and know the person through the family, and again have that really caring, empathetic connection with the patient, but really vicariously through family members. And so the only thing I could do at that time to help that family was to give them a lock of hair as a memento. That was just something I felt that the family could take away from this horrible time in their life, and at such a tragic time of year as well.
I thought of one of the first things that happened to me as a nurse that stayed with me, and I was looking after a man who'd been transferred to us and who was in the final stages of his life. And I was a very new nurse, and I was working with a really beautiful older nurse who'd been around for a while, who really took care of me in that. But I don't know if it was the conflict of that situation that stayed with me or my part in it, but he didn't want his family around. He was very removed from his family, and he was in a lot of pain, so we were taking care of that end-of-life pain stuff, but also managing the conflict of family trying to contact him and us not being able to say. So he quickly passed within about 2 hours of being with us. So it was this whole thing of someone dying very painfully without family, and we were his last point of call. And I'll never forget slowly removing all his hardware and wiping him, and then the nurse who is in charge said, "Now say goodbye to him." And it still, 15 years later, really makes me so honoured and so sad to have been part of that. So is at the heart of nursing. I mean, it's not just that beautiful care, but it's about that conduit between lives and having access to something so incredibly personal. And I just remember as she wrapped him up, and then as we covered his face with the sheet, and she said, "Goodbye, safe journey." And I just thought that was the most powerful thing that I'd ever been part of. So that's one of my stories. And I tell the students that it's not enough to be kind, you have to be smart. And it's not enough to be smart, you have to be kind. And it's, to me, the heart of nursing is not about skills, it's not about hand-holding singularly, it's about coming all together. I've got a very strong agenda, personal agenda. I want them to take away from this course that they're doing, Bachelor of Nursing, that they're change makers, that they're agents for social change and social justice, and that they play a huge role in someone's life and in the broader health system. So there's two things. So when they come to us, they always think about the person, right, which is we absolutely want them to be patient-centred, but what I like to engage them in dialogue around too is about us as a presence, a force, nurses within the healthcare sector, within society. So I want them to take away that they're very powerful and that they are future change makers, and to never downplay the influence that they have. So you're never just doing this. And when you're, I remember crazy things like putting someone's lipstick on, and she was so happy. This patient, this 88-year-old woman, went home and she died 2 weeks later, and I knew that I'd been part of something, putting a face on that had made her so happy. Don't underestimate that stuff. So I want them to know that they're powerful, that they're skilled, and that with that skill comes huge responsibility, and your humanity makes such a difference. So I love nursing, and I want these kids and these adults that have come back to know what a huge privilege this job is?
For me, being a nurse means connecting with people, and I think that's why I enjoy it so much. It's forming relationships with people, it's being a small part of their life, sometimes in a bad situation, sometimes in a good situation, but making a difference and making that situation the best it can be no matter what. I love working with the parents, the children. A lot of the time the work that I do is with critically ill children, and that can be a terrible time for families. But if you can just make it that little bit better for them, you've made a difference. So you're not just caring for that child, you're also caring for the whole family, because that's where the child has to go home to. Sometimes we have, little babies that are with us for a very long time, and that is so exciting to see them go home. And it's party when some of our little tiny babies that have been with us for a long, long time go home. It's a real celebration, and the families feel connected with us, and they come back again and again and show us their babies as they grow up. They come in and say, "Oh, look at little Johnny." It's, they're so proud and they feel so connected with us. They send us Christmas cards with photos of the kids as they grow up, and we've got photos and Christmas cards from families that we looked after, 10, 15 years ago. Sometimes the outcome isn't so good. Sometimes, of course, we have critically ill children who do not recover, and then working with families is heartbreaking, but you need to be there, and you still need to be part of that family, and you still need to form a relationship, and you can be emotionally challenged in that. But on the other hand, it can be very rewarding as well. These are things that people remember for the rest of their lives. I've worked with families where the child's going to die, and the child is dying because of something that they have done to the child. And in that instance, you have to separate yourself from that fact. You have to care for those parents and treat them with respect, and that this is the last time they will be with their child, and they feel guilty, and it's a terrible place to be in. Sometimes we have children that come in and they've been in an accident, and it's a terrible shock for everybody, and you have to make that family's experience the best it can be for those last few hours with their children, because that's all there is. Sometimes if the baby is newborn and you know it's going to die, this family are only going to have a day with that child, 6 hours with that child, and that's something you have to, it's an experience that you have to let the family have to remember for the rest of their life, so you have to make it meaningful and important.